Hello everyone. Today in this video I am going to talk about critical care CPT guidelines. The code will be 99291 and 99292. So 99291 is a parental code and 99292 is a add-on code. So learn how to code critical care service CPT guideline in this video. And the content will be what is critical care, then second critical care CPT coding guideline, then critical care time based coding, and I will give some example also. So let's get start without wasting a single time. Then what is critical care services? Critical care is a medical care for people who have life threatening injuries and illness. It's usually take place in an intensive care unit, that is ICU. A team of a specially trained healthcare providers give 24 hours care. This includes using machines to constantly monitor patient vital signs. Then critical care services are used to treat single or multiple vital organ system failure to prevent further life-threatening deterioration of patient condition. So, example like respiratory failure, renal failure, circulatory failure, etc. I will give more examples. So here you can see example of key indicator of critical care, and these are, and here you can see example of sign of aggressive management. So here you can see lots of condition like life threatening condition, cardiac arrest, COPD, CHF, dehydration with significant metabolic blood chemistry changes. Then you can find hypernatremia, open fracture, pneumothorax, severe bleeding, sepsis, seizure. Just pause the video and read each and every condition, that you will get some understanding about which condition requires critical care services. And here in right hand side you can find the managements, critical care visits, key documentation requires. So whenever you are billing for critical care services, so you need some information in your reports. So that is patient condition must meet the definition of critical illness or injury. Then second requirement will be clinical reassessment and documentation must support and description of the patient's condition, any impairment of organ system like organ system failure and all, what I explained in my previous slide. Then next, the total critical care time deliver must be documented. So we are billing 99291 and 99292 based on time. So what are the time doctors have mentioned in the critical care reports, that we have to concentrate, and based on time we need to assign CPT codes. So here CPT codes for critical care. So 99291, this is critical care evaluation and management of the critical ill or critically injured patient. So first 30 to 70 minutes, and this is the add-on code. You can see plus sign 99292. Each additional 30 minutes list separately in addition to the code for primary services. So we should not assign 99292 alone. So always 99292 goes with 99291, because this is the parental code and 99292 is the add-on code, and both codes based on time only. So here you can see first 30 to 74 minutes we need to assign 99291, and then each additional 30 minutes we need to add 99292 based on timing. So 99291 is used to report the first 30 to 74 minutes of critical care on a given date. It should be used only once per date. 99292 is used to report additional block of time of up to 30 minutes each beyond the first 74 minutes of critical care. Duration of critical care timing. So in critical care report, a doctor should mention critical care time. So based on time we are assigning CPT codes. So here this is very important table, and this table you can find in your CPT book also. So here you can find total duration of critical care, and in second column codes. So if you read carefully, you will get a very clear idea about critical care and how to bill 99291 and 99292 in proper units. So here you can find less than 30 minutes, less than half an hour, appropriate ENM code. So less than 30 minutes we should not bill any critical care. So minimum time required is 30 minutes for billing critical care services. If in your report a doctor has mentioned critical care timing as 29 minutes, then we should not use any critical care code this report. Why? Because minimum requirement is 30 minutes. Mention 29 minutes, then we should use appropriate ENM code. If the critical care service provided in emergency department, so go with emergency department ED ENM code. If it is given in hospital care inpatient setting, then go with hospital care CPT ENM code. If in next line you can find 30 to 74 minutes, if the critical time is comes under 30 to 74 minutes, then we should use 99291 into 1, means 1 unit only. If it is 74 to 104 minutes, in between, if our critical time is coming in between this 75 to 104 minutes, then we should use 99291 with unit 1 unit and 99292 with 1 unit. So 105 to 134 is parental code 1 unit and add-on code 2 unit. 135 to 164, then parental code once and add-on code into 3 unit. So like that we need to add each additional 30 minutes we should add add-on code. So critical care time, and example number 1 is critical care time of 35 minutes. If the doctor provided total time is 35 minutes for critical care, what will be the CPT code? Then answer will be 99291 into 1 unit. So it's coming under 30 to 74 minutes. So 35 in table also you can find 30 to 74 minutes. We should use 99291 1 unit. No need any add-on code. Then second example is critical care time of 115 minutes. So 115 minutes means so focus on table and find the answer. Answer will be 99291 into 1 unit and 99292 into 2 units. So same you can find in table also. 115 comes under here. 105 to 135, in between 115 is coming. So our coding will be 99291 with 1 unit and 99292 with 2 units. So it's very easy whenever you are using table, it's very clear to assign accurate code. And then third example will be critical care time of less than 30 minutes. Then what will be the CPT code? So here in table less than 30 minutes, then appropriate ENM code. So in this case we should not use any ENM CPT code. So that time we need to use a proper ENM code. If it is emergency department, then go with emergency department ENM code. If it is hospital inpatient setting, then go with hospital care ENM code. So it's very clear that we should not assign critical care CPT code for less than 30 minutes. So can't report critical care code here. So last one is procedure bundle included in critical care. So here you can find in first column CPT codes and next column is a description. If you read interpretation of cardiac output measurement, chest x-ray, pulse oximetry, blood gases, ECG, blood pressure, hematologic data, gastric intubation, temporary transcutaneous pacing, ventilator management, then vascular access procedure. These are the peripheral access, central access is not bundled. So here you can find the CPT code. So this is very clear. These are the bundle or included services in critical care. So we should not use these CPTs with critical care ENM code. Why? Because these are completely and true bundling with critical care. So if suppose in most of the time in CPC exam it's coming with 99291 is built along with 71010, so that option will be wrong. Why? Because 71010 is a chest x-ray and chest x-ray is included in critical care services. Then we should not use critical care and a chest x-ray code together. So answer will be wrong. And whenever you are going for frontline coding, that time also we should not use that included or bundle services with critical care ENM code. So I hope you guys understood. And so total critical care you need to focus on critical care time, critical illness, and then bundle services. So I hope you guys understood critical care services and how to build critical care coding based on proper CPT coding guidelines. If you like this video, then please like, share and subscribe Medical TubeMate, and click on notification bell icon for getting upcoming coding related information and updates. Thank you so much.